BDSM. BDSM encompasses a range of erotic practices involving bondage, discipline, dominance, submission, sadism, and masochism. In bondage and discipline, partners explore restraint and control dynamics. Dominance and submission involve power exchange, with one partner taking on a dominant role and the other a submissive role. Sadism refers to deriving pleasure from inflicting pain, while masochism involves deriving pleasure from receiving pain. Foot fetishism. Foot fetishism, or podophilia, is a sexual interest in feet. Those with this fetish may find pleasure in touching, kissing, licking, or massaging feet. The appeal of feet can vary from person to person, with some individuals finding specific features like toes, arches, or soles particularly arousing. Foot fetishism is one of the most common fetishes, and it can be expressed in various ways, from admiring feet and shoes to engaging in foot worship. Role-playing. Role-playing involves acting out scenarios or characters to enhance sexual experiences. Participants may adopt different roles, such as a doctor and patient, teacher and student, or boss and secretary, to explore fantasies and desires. Role-playing allows individuals to temporarily escape reality and embody different personas, adding excitement and novelty to intimate encounters. Communication and consent are essential in role-playing to ensure all parties feel comfortable and respected. Exhibitionism. Exhibitionism is a sexual interest in exposing one's body or engaging in sexual activities in public or semi-public settings. Individuals with this fetish may derive arousal from the thrill of being watched or the possibility of being caught. Exhibitionism can manifest in various forms, from flashing or streaking to engaging in sexual acts in places where others might see. It's important for practitioners to understand and respect boundaries and legal implications when exploring exhibitionism. Voyeurism. Voyeurism involves deriving sexual pleasure from observing others when they are naked, undressing, or engaged in sexual activities without their knowledge or consent. This fetish typically involves secretive observation and may range from peeking through windows to watching explicit content online. It's crucial to distinguish between consensual exhibitionism and voyeurism, as the latter can infringe on privacy and consent boundaries. Respecting others' privacy and consent is paramount when exploring voyeuristic tendencies. Leather fetishism involves a strong sexual attraction to leather clothing or accessories. Leather enthusiasts may find the smell, texture, or visual appeal of leather arousing, often incorporating it into sexual activities or fantasies. Leather fetishists may enjoy wearing leather themselves or seeing others adorned in it, indulging in sensations of dominance, submission, or heightened sensory experience. Latex or rubber fetishism revolves around a sexual fascination with latex or rubber clothing, often characterized by its shiny, tight-fitting nature. Individuals with this fetish may enjoy the tactile sensation, visual appeal, or association with bondage and dominance. Latex or rubber fetishists may engage in wearing latex garments themselves, admiring others wearing them, or incorporating latex into sexual role-playing scenarios. Cross-dressing, also known as transvestic fetishism, involves wearing clothing typically associated with the opposite gender for sexual arousal or gratification. Cross-dressers may experience excitement or pleasure from dressing in clothing traditionally worn by the opposite sex, exploring aspects of gender expression and identity. This fetish can range from occasional indulgence to a central aspect of one's sexual identity, and it's important to distinguish it from transgender identity, which is not inherently fetishistic. Sploshing, also referred to as messy play, is a fetish involving the application of food substances or other messy substances onto the body for sexual arousal. Participants may enjoy the tactile sensations, sensory stimulation, or the taboo nature of playing with food in an erotic context. Sploshing can involve various substances such as whipped cream, chocolate syrup, or custard, and may also incorporate elements of domination, submission, or role-playing. Furries. Furries, within the context of the furry fandom, involves individuals who have an interest in anthropomorphic animal characters with human-like traits. While not inherently sexual, some individuals within the furry community may incorporate elements of furry characteristics into their sexual fantasies or role-playing. Furry fetishism can involve wearing furry costumes, fursuits, engaging in role-playing as an anthropomorphic characters, or creating and consuming furry-themed erotic art and literature. Consent and respect for boundaries are paramount within the furry community, distinguishing consensual fantasy from inappropriate behavior. Object sexuality, or objectophilia, is a romantic or sexual attraction to inanimate objects. Individuals with this fetish may form emotional or physical relationships with objects, perceiving them as sentient or capable of reciprocating affection. Objectophilia may manifest in various ways, from developing deep attachments to specific objects to engaging in intimate acts with them, such as hugging, kissing, or even marrying them. ABDL, which stands for Adult Baby Diaper Lover, is a fetish involving role-playing as a baby or toddler, often including wearing diapers and engaging in infant-like behaviors. Participants in ABDL may find comfort, arousal, or emotional fulfillment in regressing to a childlike state, either alone or with a partner who takes on a caregiver role. This fetish is typically consensual and may involve elements of nurturing, play, and intimacy within a safe and trusting relationship. Acrotomophilia, also known as amputee fetishism, is a sexual interest in individuals with amputated limbs. People with this fetish may find amputees sexually attractive or experience arousal from the idea or imagery of amputation. It's essential to approach discussions and interactions about acrotomophilia with sensitivity and respect for individuals with limb differences, recognizing their autonomy and agency in their own bodies and identities. Balloon fetishism, also known as lunars, involves a sexual attraction to balloons or balloon-related activities. Individuals with this fetish may experience arousal from inflating, popping, or playing with balloons, finding pleasure in the tactile sensations, visual appeal, or associations with childhood innocence. Balloon fetishism can vary widely in intensity and expression, from a simple appreciation of balloons to incorporating them into sexual activities or fantasies. Body modification fetishism involves a sexual fascination with alterations to the human body, such as tattoos, piercings, scarification, and extreme body modifications. Individuals with this fetish may find arousal or attraction to individuals who have undergone significant body modifications, either for aesthetic purposes or personal expression. Body modification fetishism can intersect with other fetishes, such as BDSM or fetishization of specific body parts, and it's important for practitioners to prioritize consent, safety, and respect for individual autonomy. Giantess or macrophilia is a fetish involving sexual attraction to giant or oversized individuals, often portrayed as towering over others. Individuals with this fetish may fantasize about being small in comparison to a giantess or experiencing domination by a larger partner. The appeal of giantess fantasies can range from feelings of vulnerability and power dynamics to admiration for larger-than-life figures. Microphilia is a fetish characterized by sexual attraction to tiny or miniature individuals, often depicted as being smaller than average. People with this fetish may fantasize about interacting with tiny partners or experiencing domination over miniature figures. Microphilia can involve role-playing scenarios, artistic depictions, or fantasies about shrinking or being shrunk down in size. Pregnancy fetishism involves sexual arousal or attraction to pregnant individuals or the concept of pregnancy. People with this fetish may find the physical changes and fertility associated with pregnancy sexually appealing, or they may be drawn to the nurturing aspect of impending parenthood. Pregnancy fetishism can manifest in various ways, from admiring pregnant bodies to incorporating pregnancy themes into sexual fantasies or role-playing scenarios. Medical fetishism, also known as medfet, revolves around a sexual interest in medical procedures, equipment, or environments. Individuals with this fetish may find arousal in doctor-patient role-playing, wearing medical uniforms, or engaging in medical-themed scenarios. Medical fetishism can include elements of power dynamics, trust, and vulnerability, with practitioners exploring themes of examination, treatment, or care within a consensual and safe context. Tickling fetishism involves sexual arousement or enjoyment derived from being tickled or tickling others. People with this fetish may find pleasure in the sensation of tickling, the laughter it elicits, or the physical closeness and intimacy it promotes. Tickling fetishism can range from light, playful tickling to more intense forms involving restraint, dominance, or submission dynamics. Consent and communication are essential when exploring tickling fetishism to ensure the enjoyment and comfort of all parties involved. Age play is a form of role-playing where individuals take on roles of different ages, often involving scenarios of childhood or adolescence. Participants may explore dynamics such as caregiving, authority, or innocence, with activities ranging from playing with toys to disciplinary role-playing. Age play emphasizes consent, communication, and mutual understanding of boundaries to ensure a safe and enjoyable experience for all involved. Food play, also known as WAM, wet and messy, play, involves incorporating food into sexual activities for sensual stimulation or arousal. Participants may enjoy the textures, smells, and tastes of various foods applied to the body or used during intimate encounters. Food play can range from playful feeding and licking to more elaborate scenarios involving messy substances like whipped cream, chocolate sauce, or pudding. Sneezing fetishism, also known as achoo fetish, is a sexual interest in sneezing or observing others sneeze. Individuals with this fetish may find arousal in the act of sneezing, the sound it produces, or the facial expressions associated with it. Sneezing fetishism can include role-playing scenarios, watching sneezing videos or photos, or engaging in sneezing-related discussions within fetish communities. Giantism, or macro-fetishism, involves a fascination with giants or giantesses, often depicted as towering over normal-sized individuals. People with this fetish may fantasize about being small in comparison to giants or experiencing domination by larger-than-life figures. Giantism fantasies can explore themes of power dynamics, vulnerability, or admiration for size and strength. Hair fetishism, or trichophilia, is a sexual attraction to hair, whether on oneself or others. Individuals with this fetish may find pleasure in touching, smelling, or playing with hair, or they may be aroused by specific hair characteristics such as length, color, or texture. Trichophilia can manifest in various ways, from admiring hair in its natural state to incorporating hair into sexual activities or fantasies, such as hair brushing or scalp massage. Urolania, commonly known as golden showers, involves sexual arousal from urine or the act of urination. Individuals with this fetish may find pleasure in observing, receiving, or participating in urination-related activities as part of their sexual experiences. Consent and communication are crucial when exploring urolania to ensure all parties involved feel comfortable and respected. Omarashi, also referred to as a desperation fetish, is a fetish centered around the sensation of needing to urinate. Individuals with this fetish may experience arousal from holding their bladder or witnessing others in a state of desperation. Omarashi can involve role-playing scenarios, storytelling, or specific behaviors related to controlling or experiencing urinary urges. Frauderism is a paraphilic disorder characterized by sexual arousal from rubbing against non-consenting individuals in crowded places. People with this fetish, known as frauders, may seek to gratify themselves by rubbing against strangers in crowded spaces such as public transportation or crowded events. Frauderism is considered a form of non-consensual sexual behavior and is illegal in many jurisdictions. Nasophilia, or nose fetishism, involves sexual attraction to noses or specific nasal features. Individuals with this fetish may find pleasure in the shape, size, scent, or appearance of noses, sometimes incorporating them into sexual activities or fantasies. Nasophilia can range from a preference for certain nasal characteristics to a strong arousal response triggered by nose-related stimuli. Mechanophilia is a paraphilia involving sexual attraction to machines or mechanical objects. Individuals with this fetish may experience arousal from interacting with vehicles, robots, or other machinery, often incorporating them into sexual fantasies or activities. Mechanophilia can manifest in various ways, from admiring the aesthetics of machines to engaging in sexual acts involving them, but it's essential to ensure safety and consent when exploring this fetish. Plushophilia is a sexual attraction to stuffed animals or plush toys. Individuals with this fetish may find comfort, arousal, or emotional connection with plush toys, sometimes incorporating them into sexual activities or fantasies. Plushophilia emphasizes the importance of consent and ethical considerations regarding the use of objects in intimate contexts. Pygophilia refers to a sexual attraction to buttocks. People with this fetish may find the shape, size, or movement of buttocks sexually appealing, sometimes incorporating buttock-related activities into their sexual experiences or fantasies. Pygophilia is a common fetish that varies in intensity and expression among individuals. Saurophilia involves sexual arousal from soiling or dirtying oneself or others. Individuals with this fetish may find pleasure in activities such as mud play, splashing, or incorporating dirt into sexual encounters. Saurophilia can involve a range of sensations, from tactile experiences to sensory stimulation, but it's essential to prioritize safety, hygiene, and consent. Somnophilia, also known as Sleeping Beauty syndrome, is a fetish involving sexual attraction to sleeping or unconscious individuals. People with this fetish may fantasize about engaging in sexual activities with sleeping partners or find arousal from the vulnerability and innocence associated with sleep. It's crucial to recognize the importance of consent and boundaries when exploring somnophilia. Stigmatophilia is a sexual attraction to tattoos or piercings. Individuals with this fetish may find body modifications aesthetically pleasing or sexually arousing, sometimes incorporating them into sexual activities, fantasies, or preferences in partners. Stigmatophilia can vary in intensity and may involve admiration for the artistic or symbolic aspects of tattoos and piercings. Technosexuality is an attraction to technology or robots. People with this fetish may find machines, robots, or virtual entities sexually appealing, sometimes incorporating them into sexual fantasies or activities. Technosexuality can encompass a broad range of interests, from admiring technological aesthetics to engaging in intimate interactions with robotic devices, emphasizing the intersection of sexuality and technology in modern society.